before it was we were only seeing our grandparents getting issues with back pain and the spine.
Correct.
But now even 20-year-olds, everybody is suffering from spine issues and lower back pain.
See, the most common thing for back pain is the posture. There have been an influx of software professionals all over the world actually. Because of this, the software people sit in one particular place and they keep on going around with the same posture for practically hours together. 6 hours, 8 hours. They don't even budge, they don't even move around. There is no exercise done. So there, because of all these things, the muscles go into wasting. The muscles go into a little bit of spasm many times, and these things cause the patient to start off with the back pain. If suppose with a weak musculature, the person tries to lift something heavy. So already back pain patient and lifting something heavy or falling suddenly makes the disc, which is actually a sponge-like substance in between two vertebra, bony columns, it juts out from its area, and because of it coming out, it presses on the nerve root. The spinal cord has a distinct nerve root at the end.
So in orthopedics, can you tell us what conditions we can use ozone?
See, orthopedics and pain, the synonyms actually are very clear. The word pain goes hand in hand with orthopedics. So when we consider pain, actually the joints are the main areas where pain actually is seen. For example, the knee joint. Patients get a lot of knee joint problem these days because of lack of exercise, lack of movement, and in comparison to before, the way they eat, the way they sleep, the way they do things, everything has changed. So in such cases, actually ozone we give directly intra-articular, where in ozone we make sure that the cartilage is regenerated, whatever this is left back is actually retained, and along with that the pain part is tackled by giving peri-articular ozone, wherein ozone is given in subcutaneous fashion in and around the musculature of the knee joint. So there the pain actually reduces without having any rigorous amount of tablets given, and kidney is actually not affected, it is spared, the liver is actually not affected again. So we make sure that the safety is maintained to the patient, and the therapy is also given in a very easy fashion.
Hi everybody, welcome to another podcast at Arkanugra Hospital. I am Dr. Gaurang Ramesh. I am a surgical gastroenterologist and I also practice integrative and functional medicine. Today I am very glad to introduce you to Dr. Srikanth. I have had an opportunity to learn ozone from various ozone therapies from Dr. Srikanth at Ozone Forum of India in Bombay. Dr. Srikanth started his career as a hardcore orthopedic surgeon with a busy practice in trauma orthopedics and in arthroplasty, but he developed interest in preventive orthopedics and also regenerative orthopedics. His passion lies in reversing orthopedic conditions without surgery, and he went on to learn many modes of modalities of treatment to understand the whole holistic perspective of the orthopedic conditions. And today he integrates ozone therapy, regenerative modalities along with optimizing the metabolic health, hormone health, and also he implements various modalities to reduce inflammation, which are all contributing to the condition. So today I would like to discuss with Dr. Srikanth the various conditions we can treat and how we treat. So sir, thank you so much for joining us.
Thank you for the wonderful introduction, Dr. Gaurav. Thank you.
Thank you. Sir, can you first, I started the journey with you in Ozone Forum of India in Ozone. So can you tell us what exactly ozone therapy is and why is it becoming very popular in orthopedics?
Ozone therapy per se is more than a century old. So there has been many incidences even in the Second World War because of gunshot wounds and various other wounds also. People used to use ozone to repair the wounds very fast. So that was actually one of the reasons why ozone therapy was practically used in the world wars. And then down the line, ozone became one of the more anti-radical therapies. The free radical therapies is what we actually call them. So there, the movement occurred in such a way in which the body itself could produce reactive oxygen species. So there, ozone acts on 2 or 3 different molecules, the enzymes, and these enzymes are activated. Once these enzymes are activated, they work in a multimodal approach. They, for example, in the liver, they work in a different fashion. The kidneys, they work in a different fashion. But ultimately, the whole intention is to have regeneration and make sure the cells actually get more blood supply, gets more oxygenation, and ensure that whatever threatening cells, or whatever threatening bodies are there inside the body, they are removed, and whatever cells are left back have better amount of rejuvenation and better amount of classification. That is how actually ozone per se works.
Okay, so is it ozone a single modality which can be used in these conditions, or do you combine it with other modalities also?
See, the main advantage of ozone therapy is it can be used as an adjuvant. It is basically something which you can add on to your regular therapy, and many times it can be used in a single fashion also. But amazingly speaking, there are very, very few interactions till date, even when used with Ayurvedic medications, when used with Unani medications, when used with allopathic medications, even when we use ozone with a direct intravenous approach, there have been very, very less interactions, very, very less reactions seen. So ozone is very safe. Ozone is practically very, very simple to learn and very simple to administer. But we have to learn a huge amount of things about ozone therapy before we even pursue the fact. This is because ozone actually disintegrates within 20 minutes and we cannot make it into a tablet. That is not possible. So basically we have to make sure that ozone as a gas is given inside the body, either when mixed with blood, which we call major autohemotherapy, or we mix along with saline, which is called ozonated saline therapy. So there are various ways in which we can administer ozone into the body, but ultimately ozone is a adjuvant therapy. It is integrative medicine actually calls it adjuvant because you can mix it along with whatever else you are given to the patient and get better benefits to the patient in comparison to whatever the previous therapy was actually giving.
That's wonderful, sir. So in orthopedics, can you tell us what conditions we can use ozone, sir?
See, orthopedics and pain, the synonyms actually are very, very clear. The word pain goes hand in hand with orthopedics. So when we consider pain, actually the joints are the main areas where pain actually is seen. For example, the knee joint, patients get a lot of knee joint problem these days because of lack of exercise, lack of movement, and in comparison to before, the way they eat, the way they sleep, the way they do things, everything has changed. So the number of cases of knee osteoarthritis is escalated. It is very, very high. So in such cases, actually ozone we give directly intra-articular, wherein ozone helps regain the cartilage. We make sure that the cartilage is regenerated. Whatever this is left back is actually retained, and along with that, the pain part is tackled by giving peri-articular ozone, wherein ozone is given in subcutaneous fashion in and around the musculature of the knee joint. So there the pain actually reduces without having any rigorous amount of tablets given, and the kidney is actually not affected. It is spared. The liver is actually not affected again. So we make sure that the safety is maintained to the patient, and the therapy is also given in a very easy fashion. And this can be given to generally all cases in terms of managing pain. But in cases of grade 1 and grade 2 osteoarthritis, in those conditions, we can actually make sure that the patient is pain-free for a long time, manageable with exercises, and maintains that knee joint in that supple fashion without going into the surgical part. In grade 3 and grade 4, we can manage the pain part in a very easy fashion, but we cannot make sure that the reversal occurs because there will be bony deformity, there will be some mechanical restriction to whatever treatment we give. In those conditions, we make sure that the patient is pain-free without having any other reactive issues in terms of medications and stuff, but reversal of osteoarthritis is not seen. In those conditions, we make sure that the pain is maintained with a healthy, happy patient. That's what we actually try to call it.
So how many times do you have to give this therapy in grade 1 and grade 2, sir?
Actually, it varies from patient to patient. Suppose we have a patient having only osteoarthritis, grade 1 and grade 2. In those conditions, maybe around 6 to 7 sessions, at the most 10 sessions are required to clear it on a weekly or bi-weekly basis. But if the patient has osteoarthritis secondary to some metabolic disturbance, like hypothyroidism, like a prostate issue, in certain conditions where water retention is leading on to the pain, or in certain conditions where collagen, which is inside the body, is become loose, in those conditions, it takes a pretty long time. So we, in functional medicine, in regenerative orthopedics, we make sure that we diagnose the condition, we make sure that the cause actually is dealt with properly, and the whole body is treated along with it in the knee joint. So in those conditions, it takes a little more time, but the patient is satisfied for life. It is not a 1 week, 2 week regimen where after that, when you stop the injections and stop the therapy, the patient goes back to his normal, abnormal form, not normal form. In these conditions, actually, we make sure that the patient is having a lasting relief and is maintained well for at least 5 to 10 years, having all the therapies done in a proper fashion.
Can you tell us what exactly is regenerative orthopedics? Why is it called regenerative, and is there anything else we do with ozone in regenerative orthopedics?
See, the actual term for regenerative orthopedics is orthobiologics. Orthobiologics implies ortho bone, biologics is the way, the mechanism or the way the body actually functions inside, that is altered. So there, in terms of the knee joint, there are various things which you have to consider. One is the ligament, one is the collagenous structures inside, third again we have the bony structures inside. So all these things are actually having destructive things inside, which is causing the pain. So in terms of mechanical obstruction, where the bone is touching the bone and the cartilage is actually lost, in that condition, obviously even injections, even therapies, whatever we do, that doesn't work. Suppose there is cartilage regained, but the space is still there. In such conditions, actually, when you give ozone, there are chances of the cartilage getting back into formation, which can actually see in an X-ray having a high density. So in these conditions, actually, we make sure that the patient is having physiotherapy along with this to get back the musculature and make sure that the patient is back in action with a lot of things. Okay, so then we up it up with PRP along with platelet-rich plasma, wherein we take platelets from the body, we segregate platelets and make it in a higher fashion, and then we insulate inside the knee joint. This actually regenerates the cartilage a little better, and when given along with ozone, it has a better effect. Ozone actually has the potentiality to increase the effect of PRP. So many times we advise along with ozone to add platelet-rich plasma and help the patient away. And one more thing which we actually use is called ADSC, adipose-derived stem cells. So there we take the cells of the abdomen, just like lipolysis, liposuction. We go into the abdomen, we remove the abdominal cells. There we segregate fat cells from there, and then after we centrifuge the same thing, we insulate it to the knee joint. So this is the best part, wherein the patient is actually happy for being fat instead of being sad about it. And the knee joint is also regaining things, and the patient is more happier than ever. This thing lasts for a pretty long time. So all these things form a part of regenerative orthopedics and orthobiologics. One step above this is nutrigenomics and functional medicine. In regenerative orthopedics, we limit ourselves to only the knee joint. In functional medicine, we take help from you, we take help from various other people who make sure that the metabolic disturbances occurring inside the body are actually countered, and the patient's problem actually is taken care of along with the knee joint being dealt with. So we have a multimodal approach in case of functional medicine, which actually is the best part in case of whatever we actually do over here at Akka Hospital.
So in osteoarthritis itself, when do you choose when to do just ozone or with PRP or with stem cells? Is there any indications for you to decide when to do?
Yeah, we go by the grading of the osteoarthritis. Grade 1, grade 2, we see according to the X-ray. And when the patient comes walking to us, if there is a deformity, a bow leg deformity for example, or if the patient has a deformity of the knee joint, in those conditions actually we cannot help the patient completely. In such conditions with deformities, we make sure that we help the patient get a pain relief regimen. So there we ensure that the patient gets rectal ozone for example, that makes sure that the body itself is energized and the area surrounding the knee joint actually gets better amount of oxygenation and more blood supply. And then we give periarticular ozone in those areas, and that makes sure that the pain in the surrounding areas comes down. Then we go inside the knee joint and try to rejuvenate. But the assurance in those cases is practically around 10%. We cannot give better results even because of the deformity part, because the bone actually is touching the other bone over there in the knee joint, and we don't have space, the cartilage is completely torn. So there the assurance is very, very minimal. Whereas in case of osteoarthritis grade 1 and grade 2, because of the amount of space involved, because of the cartilage structure still being retained up to around 80%, in these conditions we can regenerate the cartilage and give better results with ozone, prolotherapy, prolozone and orthobiologics. So this basically helps in case of beginning stages, youngsters, athletes, sports people. These are the ones actually who get more benefits out of ozone and prolotherapy and PRP as an adjuvant therapy to whatever we do.
One interesting thing you said, sir, is about we look at all the aspects leading to the degenerative changes in osteoarthritis.
Correct.
But one argument which orthopedic surgeons always give is that all these things, whether it's the diet, hormones, nutrigenomics, work only for inflammatory arthritis, and they say there's no role in osteoarthritis when there is degenerative cases. Do you see any role in osteoarthritis and degenerative arthritis also, where the role of the holistic approach which we do?
The knee joint itself is like a temple. It has a big structure inside. We consider it the god. That knee joint actually is surrounded by a lot of, all these things actually form the complete knee joint. So we can never consider the knee joint as having a femur bone on the top and a tibia bone in the lower part, and along with that the patella. So these are three bones which are actually there, but these three structures are made sure that they last nicely. They are there by various other supports in the surrounding areas. These supportive structures become loose, become lax. They have a little bit of water retention, causes them to go a little bit of, lose their texture, lose their tension. And all these things actually are the reason why the knee joint actually suffering. That is the cause for the osteoarthritis. That's why even in age-old books, even if you take it up, the osteoarthritis is termed as two things: primary osteoarthritis and secondary osteoarthritis. Primary osteoarthritis is because of degeneration, age-related changes like that. Secondary osteoarthritis is basically because of inflammation, because of sepsis, because of various other reasons why the knee joint is actually corroded. The destructive mechanism occurring inside the knee joint will be having a reason. In those conditions, anti-inflammatory markers is one thing, going out with tuberculosis and various other tests is one more thing. And there are certain patients having collagen vascular diseases, and these things are related to the gut, related to the microbiome, and addressing the gut, addressing the various nutritional deficiencies definitely will ensure that the knee joint gets better strength, better movement and turgor. So this actually is the reason why we have to make sure that the secondary osteoarthritis patient is dealt with in a better way, with a lot of changes occurring inside the knee joint due to some other nutritional deficiency factors which have not been taken care of. That actually helps the knee joint come back into action.
That's very interesting, sir. So this is something which generally this demarcation is not made.
Correct.
Patients are labeled as just osteoarthritis, and whether it's primary or secondary, and as you said, for secondary, the inflammation is the primary driver of the disease.
Absolutely.
And we are trying to look at all the factors which is contributing to inflammation. So many times patients, ask me, why are you telling me to follow a diet? It is a bone problem. So I try to explain to them that the inflammation which is driving the osteoarthritis changes, the gut can be a major cause. And we have to look at gut like a permeable structure. It has to be absorbing only what is required and not absorbing what is we don't need.
Correct.
And a lot of proteins, as nowadays there is so much fancy about the protein intake, and as people grow older, they are not able to digest them.
Absolutely.
And when these undigested protein are actually going into the gut, and stomach acid and the digestive enzymes are not able to simplify them, they start troubling the intestinal lining, and these undigested protein create a response from the immune system that drives the inflammation up, and it can contribute to the secondary arthritis also. So this is what I keep telling patients, that you have to look at all these aspects to even though you're working on the knee and joints. So what about autoimmune knee issues and rheumatoid arthritis? Is there a role for the regenerative orthopedics and ozone in that?
See, basically in cases of autoimmune diseases like rheumatoid arthritis, SLEs and various other arthritic patterns, one of the prime things they do is they eat the soft tissue surrounding structures, whereas the bone is the last thing to go. The bone easily wears out because of lack of support from the soft tissues. These soft tissues actually are weakened because of lack of collagen and lack of various other undernourished structures inside, which cannot be replaced by conventional treatment. And many times when we eat something wrong, like lecithins, even lactose and various other glutens and stuff, so these things actually harm the knee joint a little more in case of autoimmune disorders. So we devise a separate regimen, a nutrition diet where actually the patient will be benefited much more better, along with the nutritionist obviously, because our limitation to our knowledge is always there, and we take the help of a nutritionist to develop all these things. So there the elimination diet actually makes sure that what patient actually requires is going inside, and what patient will cause like harmful effects to the knee joint is taken care of in a different way. So this needs some testing, this takes some time to identify what that particular patient has problems with. So there down the line we come to know after 2 or 3 sessions where the patient is actually causing, getting the problems from, and how the patient has to be tackled. So when we come to that conclusion, then the patient is actually taken care of so nicely that the patient has a long-lasting pain-free life without having any tablets, without having any medication, without even coming to us on a regular basis. We ensure that the patient just has a diet chart maintained properly, so that lifelong the patient can make sure that the person does not have the autoimmune effects, reversals, and the problem actually is taken care of nicely.
Yeah, so when in acute pain, when they're already on steroids and or methotrexate or DMI, disease modifying agents, or they're on biologicals, do you still feel there's a role for all these things to play? And
See, the advantage of orthobiologics, ozone and prolotherapy is, along with all these, it can be given. So we need not withdraw anything. Only thing is, once these things start to act, the requirement of the DMARDs, the requirement of the various other biologicals and various other stuff is very, very minimal. The patient need not take those. And as far as painkillers are concerned, there are extremely safe painkillers which we use, and these painkillers actually don't cause any harm on the kidneys, on the liver, or any other organ in the body which may cause harm by conventional painkillers, analgesics that are generally used. So ozone per se does not have any problem. Down the line, actually, when the patient is taken care of, using ozone therapy, using various other orthobiologics and everything, the patient is weaned off from these DMARDs, from various other things. The patient is put on an elimination diet in the beginning, then a restricted diet down the line, and make sure that the patient eats whatever the pain relief actually has to come. So this is taken care of in a very, very nice fashion. So the requirement of all these medications is very, very minimal. It is not required at the initial stages, but down the line, actually we wean it off, and then we make sure that the patient is cleared out of the disease. So there is a way in which the patient is actually weaned out and ensures a happy, healthy life without being on tablets the rest of their lives.
so another argument I always get is that surgery is just a matter of 2 days hospital stay and another 2 weeks, 3 weeks of taking care,
Correct.
and it's done. Why should I, put in so much effort and struggle and get injections and go through all this? Is there any advantage of going through all this over doing a surgery?
See, arthroplasty, like total knee replacements, it has become a fashion from many years because of UK, England starting off the whole role of getting things done in a beginning fashion itself. But as far as things are concerned, once you take out the God-given gifts, getting it back is not there. Okay, so once the knee joint actually is removed and it is replaced by a steel part or a titanium part, whichever we put inside, then there is no reversal. That is the end of it. So as far as we are concerned, we make sure that the surgery is the last term used. Okay, we make sure that the patient has the benefit of the non-surgical part till we are very sure that we cannot help. So the last resort is the replacement. Till then, we have to ensure that the patient is actually sustained, maintained, is moving around freely, working nicely, having a good amount of quality of life, and all these things are done without going out with arthroplasty. But there are certain advantages of arthroplasty. It's not like we are ruling it out. In certain cases where deformity is there, where we cannot do anything. In certain cases where the patient actually has acute pain, where even waiting for a period of 2 to 3 months for these things to act and everything is going to cause issues. In those conditions, definitely a replacement is warranted. Then 100% we advise the patient to go ahead with the knee replacement as soon as possible. That is not a problem, and affordability is the next main thing. But as far as things are concerned, after knee replacement also, if the pain is still there, then let us think that the cause for the pain actually is not the joint. The cause may be in the surrounding structures, the cause may be a metabolic syndrome. At least in those cases where, for example, surgery has been done, but still the patient is suffering from pain, still there is swelling surrounding the knee joint. In those conditions at least, functional medicine definitely has a say in matters. We can make sure that the reversal occurs very, very nicely. Even in post-surgical cases also, we can make sure that the patient weans out and comes out of the pain part without having any problem.
So that was very interesting, sir, about the knee joint. So to conclude, what you're saying is that we have to go deeper into what is contributing to the inflammation. We have to grade the disease. We have to look at all the contributory factors.
Exactly.
All the etiologies, what is causing the issue, and locally treat the inflammation with the ozone and orthobiologicals, and also systemically reduce the inflammation. And we're not saying surgery is absolutely not required. It is always an option. We can keep it as a last option when it's reached a stage where we cannot do anything.
Exactly. But one more thing which you forgot to mention is about the gut.
Yeah.
Okay, so the gut actually is the main role to play. The gut actually has a lot of structures inside which make sure that the components whichever we eat actually are beneficial or poisonous. That makes sure that things are actually done in a proper fashion. So in this regenerative orthopedics plus nutritional therapies and other stuff, may we ensure that the diet chart is given in a proper fashion. We ensure that the patient takes it in a proper fashion. It is not simply given to the patient. We insist and many times we give to the patient, this is the diet you're supposed to use, and we parcel it and give it many times, because otherwise the patient may not get the same thing outside. So that is how actually we make sure that the whole thing is taken care of in a proper way.
That's very interesting, sir. So we've discussed about the knee joint. Can you tell us about the shoulder joint? Is there a role of all this in shoulder issues? What kind of shoulder problems can benefit from these therapies?
See, India definitely is a diabetes capital of the world. So right now the number of diabetes cases has escalated many times, exponential increase in diabetic cases. So many cases of diabetes, the capsule actually goes into adhesions. Adhesions imply that becomes like a gum. So because of that viscosity increase, the patient is not able to get a full range of motion of the shoulder joint. In those conditions, there are 2 or 3 things which are very important to diagnose. The patient cannot sleep on that side because the affected shoulder joint actually is a little angled forward, and then the patient cannot lift it up or lift it backwards, and the pain very rarely radiates from there up to the middle of the arm. So in this condition, we call it this adhesive capsulitis, sometimes a frozen shoulder is actually a common term used. In this condition, actually we have to release the capsule. Release of the capsule is very essential to make sure the range of motion comes back properly, and many times forcibly releasing the capsule, forcibly releasing the shoulder joint has caused the shoulder joint to dislocate and the humerus to get a fracture. So these things have to be done in a very, very cautious, very, very nice fashion. Ozone therapy has such a nice result wherein we give injections directly into the capsule area, into the shoulder joint intra-articular, and slowly we make sure that the range of motion comes back to the patient, and gradually the patient gets relief starting from around 40 degrees to up to around 110 degrees over a period of say around weekly once, monthly once, like that. Around 2 to 3 months are required. And we add, along with ozone therapy, we add prolozone therapy, and along with that physiotherapy to make sure that the patient gets complete relief. This is a painless procedure where the patient will get benefit in a matter of say around 15 minutes or 20 minutes. At least 10 to 20% of the shoulder joint actually is released in a matter of one session itself. And down the line, actually patient is very comfortable because the lack of pain is very easily felt, and because the motion actually comes back into action. So frozen shoulder is one of the prime things which we treat in case of shoulder joints.
And along with, so you're even here you're saying that it's not just ozone, but we need to complement it with physiotherapy and exercise.
It's always wise. Depending on only one therapy, actually make sure that if that therapy fails, we don't have any other option. The advantage with ozone is you can mix it along with various other therapies without having any reaction, without having any problem. That's why along with ozone therapy, we usually prefer physical therapy, because physical therapy makes sure that the joint is actually getting back into action, the mobility is given back to the joint. So it's a very easy way of getting things done. But only physiotherapy will not release the joint completely, because then the force implied will be too heavy. So ozone will release the capsule, make sure that the adhesions actually are, adhesiolysis is what we call it. Adhesiolysis is done in a proper fashion. Physiotherapy will make sure that slowly the joint gets back its motion. So when you mix physiotherapy, ozone therapy and prolozone therapy along with all these things, then the results are astounding. It becomes very, very fast, and becomes very naturally the patient comes back into a normal life.
So is there a role for ozone to play in all kinds of shoulder pain issues?
Various kinds, I agree. But in case of shoulder osteoarthritis, definitely we cannot do much. That is something which actually we avoid treating. Because in case of osteoarthritis of the shoulder, which is very rarely seen, the shoulder joint actually goes down a little and we cannot go into the joint directly. And in certain conditions like supraspinatus tendinitis, wherein there will be a small tear in the rotata cuff. If the tear is very small, and in those conditions surgery may not be required, in that condition we give ozone directly into the area along with PRP. PRP makes sure that the tear is actually healed a little better, and ozone makes sure that the healing actually occurs along with fibrosis. So this technology makes sure that the tendinitis actually heals in a matter of around 4 to 5 sessions, and the patient is able to get a good mobility and a pain-free joint in a matter of around a month or 2. So that is one of the commonest things we have seen in case of sports injuries, okay, wherein you have javelin throwers, you have shuttle badminton players. All these people get a tear very, very fast, and sometimes due to degeneration, if the tear occurs, then obviously we don't treat the case. There, surgery is the only option, and we basically maintain the patient with a little bit of exercise and mobility. But in case of non-degenerative tests, due to trauma, due to other things, definitely we have a role to play.
So if the injection is not given at a correct plane, or is there, if any mistake is there in the application of the ozone, is there any side effect we have to be worried about?
If it is in the shoulder joint, definitely we have to worry about it. That is why it is very essential to ensure that the treatment is given by a proper person who has actually had enough, the research done by him and the amount of teaching taken hours together, and the person has enough amount of experience. All these things make sure that the injection given is actually directly into the place required. And many times, in case we don't have a proper way, we get an ultrasound scan done where we localize where the tear is, and we have ultrasound guided injections also, wherein we go along with the ultrasound scan and go inside the joint so that we don't miss the place as such.
That was very interesting, sir, about shoulder joints. So one more major problem we are having, and it's filling up the orthopedicians' clinics, are the back pain and the spinal issues. So today, before it was we were only seeing our grandparents getting issues with back pain and the spine.
Correct.
But now even 20-year-olds, everybody is suffering from spine issues and lower back pain. So why do you think this is happening, and what's going wrong there?
See, the most common thing for back pain is the posture. Okay, the more amount of time you sit, the more amount of back pain you get. So it's a simple way. Before, actually, we used to tell the children to go outside and play. There were open playgrounds moving around. Now you see the child basically sitting at home with a mobile in the hand. The shuttle badminton goes on in the mobile. The tennis goes on in the mobile. So various outdoor activities are basically done indoor. And that too, the only exercise the child actually gets is the thumb exercise. So other than that, the exercise in the other parts of the body is very much ruled out. The same thing goes in favor of adults also. There have been an influx of software professionals all over the world actually. Because of this, the software people sit in one particular place and they keep on going around with the same posture for practically hours together, 6 hours, 8 hours. They don't even budge, they don't even move around. There is no exercise done. So there, because of all these things, the muscles go into wasting. The muscles go into a little bit of spasm many times, and these things cause the patient to start off with the back pain. If suppose with a weak musculature, the person tries to lift something heavy. So already a back pain patient, and lifting something heavy or falling suddenly makes the disc, which is actually a sponge-like substance in between two vertebra, bony columns, it juts out from its area, and because of it coming out, it presses on the nerve root. The spinal cord has a distinct nerve root at the end. So there, once the disc actually presses over there, the pain starts because of a disc prolapse, and the pain starts on the back and goes towards one leg. Okay, so depending on the quantum of the radiculopathy, you can identify whether it is a L4-5 disc or L5-S1 disc, and obviously we get an MRI done to see all these things. But the number of cases has escalated because of lack of exercise, because of lack of posture in a proper fashion, and various other aspects like food actually is one of the main contributing factors for back pain right now. So we actually make sure that the back pain is countered without surgery in the initial stages. We make sure that the back is stabilized, the posture is made in a proper fashion. The patient has to realize the cause, only then we can treat. So we make sure that the patient has a discussion with us when all these things are there. Once the discussion is clear and the patient comes to know, we give something called paraspinal ozone injections. These paraspinal ozone and prolozone injections make sure that the paraspinal musculature, the muscles surrounding the spine, they will be in spasm. That spasm is relieved when the ozone injections are given. Once the spasm is relieved, then the patient is put on physiotherapy and exercise at home itself. They can as well do the exercise at home, because it's not a major thing where you have to go to a physiotherapy center. Once the exercises are done in a proper fashion and maintenance is done, then things will be stabilized with other root factors. Suppose we have a case of disc prolapse as such. In low back pain, where the pain starts from the back and goes towards the leg, the disc actually is the culprit. So what we generally do in conventional surgical aspects is, we remove a portion of the disc which comes out, and that portion of the disc which is pressing on the nerve. In terms of ozone, we do what is called ozone nucleolysis. The disc will be having a nucleus pulposus inside, which will be having a little bit of water content. So ozone will act on the water content and shrink it. It will dehydrate the disc. The dehydration will be very, very minimal. It won't be something wherein the disc will collapse completely. It will just be sufficient for the pressure on the nerve to come down. Once the pressure on the nerve comes down, then either we give a nerve block using ozone and prolotherapy, or we make sure that the patient is put on nerve rejuvenators and physiotherapy, and the patient is maintained. So youngsters having disc prolapse, This is the prime approach, wherein they need not go ahead with surgery and other aspects, and they can maintain their lives without having any problem. Suppose we have the same in an elderly person, and the water content in the disc is actually reduced. In those conditions, the assurance given is pretty less, because the water is what we are dependent on, the water content inside the disc. In those conditions, we give a pain portal block along with going ahead with the ozone discectomy, so that the pain also comes down, patient is also comfortable, and things are stabilized.
So you're saying the back issue has the disease progression starts with a simple muscle spasm.
Yes.
And when we don't take care of that and work on that, it becomes a prolapse, and then it progresses to compression on the nerve. And we have seen that when they go under the table in the surgery, it becomes a lifelong issue, because many times the plates are not in position and they need a revision surgery, and revision surgery becomes more extensive and they may harm the nerve also. So definitely ozone has a role to play in preventing us to end up on the table. So what else complements the ozone and prolozone therapy? Do they have to do anything else?
See, we advise the patient to go ahead with domestic exercises is one thing, and then an elimination diet, as we discussed before, that actually makes sure that the spasm is under control and the various parts of the musculature are back in action. And we give some additives, nutraceuticals, which are basically like levocarnitine, we have alpha lipoic acid, and all these things make sure that the musculature gets back its strength and rigor, and the patient is comfortable down the line. So all these things are supportive. The primary thing is the disc coming out. So that has to be dealt with in a proper fashion. Either we have to go ahead with ozone directly into the disc, or we have to go ahead and operate and make sure the disc is removed. So it's either ectomy, where the disease is taken out, or lysis, where the disease is shrunk. So without these two approaches, the other things don't work. So one of these two have to be maintained properly.
That's wonderful, sir. So we have covered a lot of conditions today. So is there any other conditions you would like to see that ozone has a big role to play?
One main condition which we have come across in case of nutritional medicine and functional medicine is trapezitis. Many patients have neck pain, cervical pain, and if you see the X-ray, because all of us are standing, the maximum pressure of the head is taken by the cervical spine. So either there will be a little bit of spondylitic changes, or there will be a little bit of crust disc space in that area. So generally speaking, judging by the X-ray, we diagnose it as being cervical spondylitis or a disc prolapse, and many times we operate on the patient also. But in certain conditions, usually the neck pain will be due to the trapezius muscle, which is a muscle starting from the nape of the neck and going up to the lower back. That muscle will be in spasm, or it will be stretched beyond undue limits because of water retention. A metabolic syndrome like hypothyroidism, like prostate issues, various other conditions where water retention occurs, these cases actually have to be counted properly. So trapezitis is a differential diagnosis which has to be considered in case of cervical spine. In case of trapezitis, if you have diagnosed the condition as being due to the trapezius muscle inflammation, there we give localized injections of ozone in the surrounding areas. There are certain markers which we have, and along with ozone we give prolotherapy in those surrounding areas, and down the line the patient actually recovers in a matter of around 3 to 4 weeks. It's not like it takes ages. The same patient would have taken months together to get relief in any other kind of therapy. So they're diagnosing the condition and ensuring that the trapezitis is diagnosed properly, the cause for trapezitis is actually dealt with, and making sure that the pain relief is given. This makes sure that the whole triad, the whole cycle is maintained properly, and trapezitis is countered. So neck pain we have to diagnose in a better fashion. I request many doctors who are seeing cases of neck pain to have a look at the trapezius, to check if there is any pedal edema, if there is any facial puffiness, if there is any palpitations, any symptoms like that, and to get some diagnostic tests done in terms of hormones, in terms of metabolic issues, and make sure that the patient is first taken care of without all these surgical aspects in mind. Once these things are countered and we are 100% sure that the disc is the culprit, that the patient is definitely having issues because of the cervical spine, only then the patient has to be taken up for surgery. So ozone actually has a primary role to play in these cases, and we ensure that the patient actually recovers and maintains very nicely all his life.
Yeah, one very interesting thing you said that is today we are moving towards super specialty, where we are going into specific things. Now after orthopedics, they want to just focus on spine or knee and or hand. Now again, if they want to focus on one specific joint. So But what you're saying is to really come to a proper diagnosis, we have to remember the general physical examination, look at all the other factors contributing to it, and only then come to a conclusion that it's a local problem and not a systemic contribution is not there.
And that is exactly what I mean to say, because we are doctors primarily, and we are general physicians as far as that is concerned. So that general physician attitude has to be with us. Once you have a patient and the patient is in front of you, consider the patient first, consider his needs, consider his symptoms, discuss with the patient what he has before you judge and go ahead with certain tests. Once the tests are done, cross-check the tests, because not every test you have has to be dealt with. Okay, once those tests are done, again we have to go ahead and see the patient, make sure that the tests and whatever symptoms and signs the patient has is correlating, and then down the line take the decision. Without having a practical discussion with the patient, without having a general approach where we consider the whole patient and not only his joint in particular, okay, we cannot treat the patient holistically. It is not possible. So the main way in which we have been trained from all these years is to approach the patient as a human being, not approach the patient as only a knee joint moving around. Okay. Then down the line we make sure that the patient is practically pain-free, the patient has a good quality of life, and not only has a good knee joint moving around. So that is how the approach has to be.
That's very true, sir. We have been, at least I have the experience of working with you for almost 3 years now, and we have seen good number of results in joints and even in preventing people to undergo surgeries. But why is there reluctance in accepting these modalities in regular orthopedic associations and other?
There is no reluctance as of now. Now things have changed, and for the past so many years, everybody is going ahead with all these tests and going ahead with all these movements. As of today, ozone therapy is accepted, orthobiologics is accepted, and orthopedic surgeons and various trauma surgeons all over the world, they are ensuring that the patient gets the benefit from whatever they have learned before in their medical days, MBBS, and along with the tests done, the various modalities dealt with, all these things are taken care of nicely. Some years back, say around 10 years back, the approach was different. It was more like the scalpel doing all the beating. Okay, as of today, it is more like the patient and the doctor having a discussion. Then once the discussion is done, then we go ahead with various other aspects. The patient is being treated by orthopedic surgeons in a very, very nice way and in a very, very exclusively holistic way. So all of us are making sure that the change is done in a proper fashion, and things down the line actually are towards the patient and not towards only the joint replacement.
That's wonderful, sir. It was a wonderful discussion. We have discussed about various joints and all the different modalities of how regenerative orthopedics can be a game changer in preventing surgeries and also in having a better quality of life for the patient. We'll look forward to more discussions with you, sir, about other aspects of ozone therapy and advanced ozone therapy and mechanisms of how all this works. And also we can go into discussions about regenerative orthopedics in more detail in upcoming discussions.
Definitely. It was a wonderful discussion, Dr. Gaurang.
Thank you so much for joining us, sir.
Thank you, my pleasure, completely.